My name is Brian Christensen. I'm a Master's of Athletic Training student at Trinity Lutheran. This is my review of the article on a compression modality, specifically the Normatec commercial compression device. Here's my reference. So this study uses intermittent compression to mimic cool down. The idea behind that is to decrease recovery time, clear blood lactate, and have people feeling a little closer to 100% in follow-on training sessions. So the methods, they only use female student athletes, and specifically they had backgrounds in lower extremity dominant sports. It didn't specify what those sports were, just that they were lower extremity dominant. For this test, we used the anaerobic Wingate cycling test. What the athletes did is a 2-minute warm-up followed by a 1-minute max effort. They took their blood lactate level before they started, and then again immediately after exercise, and then after 20 minutes of a cool down. And the groups were split into 3 different interventions with the intermittent compression, active, and passive. Active being getting the heart rate lower using similar exercise. So since the Wingate cycling test is on a bike, what they did is, instead after the max effort, is they pedaled at a much slower submaximal pace to help flush the blood lactate from the muscles and cool the body down properly. With the other group getting off the bike and putting the Normatec leg sleeves on and using the compression. And then passive is they pretty much got off the bike and didn't do anything. So our results, the compression group had significantly lower blood lactate than the passive group. However, there was no difference really between the compression and active recoveries. So conclusion, compression and active recovery are both successful in lowering blood lactate levels. Both of them help flush the system or flush the muscles, get oxygenated blood to, in this instance, the legs, and kind of help get rid of that blood lactate and help the athletes get help the athletes get back to sport as fully as possible in the shortest amount of time. And the nice thing with the compression is it mimics the muscle venous pump, which is the same thing that the athletes were doing that did the active recovery. So our clinical application, in a clinic, the leg sleeves, obviously, if you have a lot of athletes, then you only have a certain number of the Normatec. And you wouldn't be able to treat as many athletes as possible, whereas if you were to do a proper cool down after practice, whereas say after soccer practice, they did a lot of max effort sprinting up and down the field. If they were to jog it out for their cool down, lower the heart rate, help flush the legs, etc., would utilize the same result. That would be as a post-practice setting. In a clinical application, though, we could ideally hook them up to these sleeves as 20 minutes, even 15 minutes to help flush the legs and get them on their way. So that's kind of how we can use this in the clinic itself. So what I found is it's kind of a small test pool. We don't know what sports they came from. We just know that the athletes were from leg-centric sports. So that could determine the outcomes if they were all from the same sport or just different ones. But use a different testing method so we have a better, more data points. And then the fact that they were only using they just did one study. They didn't do a full, like a week's worth or a month's worth or whatever. They did one test and did their results off of that. So in future studies, use a larger test pool, include different sports, and more specifically look at the compression versus active, as we ruled out that the passive is going to for sure give us different results. So if we want to know the difference between compression and active recovery, then that's where we want to focus. Use different types of tests other than just the Wingate, and then use like a week's long or a month's long span to get more data points and figure out exactly if there's a difference between compression and active